Mental health is the wellness of the mind.
A mental health challenge is a mental obstacle that you go through, whereas a mental health disorder is a current chronic stress that you go through every day.
Yeah, so 3 mental health issues that youth are facing today are depression, anxiety, and ADHD.
About 1 in 5 adults have a mental illness in any given year.
Stigma is a phrase or word to increase the stress on someone or to hurt the person's feelings to the point where it affects their mental health. Here are 5 things that can help stop stigmatization. Number 1, treat others how you would want to be treated. Number 2, ask people how they're doing. Number 3, stand up for one another. Number 4, try to be nicer to someone if someone is being mean to them or if they're having a bad day. And number 5 is to compliment someone who is feeling down. My mental health disorder that I chose on my presentation was the drug abuse disorder. It is under the substance use disorder category. Who is at risk? So the people who are at risk are children and parents of broken families and people suffering of depression and anxiety. What does it look like? Well, physical appearance begins to change, such as bags under eyes, teeth begin to rot, skin begins to peel or something like that. Just like your body just gets all messed up, especially your internal organs such as your lungs and your brain can also. Then there are behavioral changes that come with it too. What is the criteria for diagnosing? Hazardous use, social or interpersonal problems related to use, neglected major roles to use, withdrawal, tolerance, use large amounts, repeated attempts to control use or quit, much time spent using, physical or psychological problems due to use. Activities given up because of the use are sports, sometimes even school, and jobs. Craving. There's craving. Nicotine is a big craver because it's the brain's stimulants or hormone that gives off the craving for something. And in cigarettes, for example, in cigarettes, there's nicotine, and that makes you want to crave the thing even more. What can you do about it? If you are a drug user, then you can go to rehab and reach out to your family or friends. What question would be a good thing to ask to a person who's struggling with this? Is everything okay? How can I help you? Hey, I'm worried about you. Are you doing okay? For someone who's around and they notice these behaviors or these physical appearances about a person and they think that they have a drug abuse disorder, here's what they can do. They can use the algae method or they can use the 4 Ps. The algae method is assess the harm, listen non-judgmentally, give reassurance and information, encourage appropriate professional help, encourage self-help and other support strategies. The 4 Ps are preserve life, prevent further harm, promote recovery and resiliency, provide comfort to the person who is injured or experiencing behavioral or emotional distress.
Family is the final option. Professional help such as doctors and therapists.
If you're feeling suicidal, you should call 1-800-273-8255, the suicide hotline number.